Thank you for joining us today. We're thrilled to have the opportunity to speak with you about something that affects millions of people every day, joint health. My name is Erica Fritz-Iannucci. I'm a physical therapist and the National Director of Comprehensive Degenerative Joint Disease at Select Medical. I'm joined today by my colleague, Michael Cornick, who is also a physical therapist and is our OrthoVive Joint Health Program market lead in Cleveland and an expert in joint care. Whether you're here because you're experiencing joint discomfort yourself, supporting a loved one, or simply interested in learning more, you're in the right place. Today, we'll be talking about common joint conditions, especially arthritis, and how it can impact your everyday life. Our goal is to empower you with knowledge and tools so that you can take charge of your joint health. Let's start by defining exactly what degenerative joint disease is. We often refer to this as DJD. It's a term we commonly hear but may not fully understand. There are several forms of degenerative joint disease, with the most common being osteoarthritis, so we'll use these phrases interchangeably today. DJD is not simply a wear and tear disease, as we commonly hear. In its most basic terms, DJD is characterized by cumulative changes to a joint and its surrounding tissues that can result from mechanical stress, which is the wear and tear part of it, from genetic predispositions, so thanks mom and dad or your Aunt Gertrude, and from inflammatory processes. This diagnosis typically develops gradually over the years and often manifests itself as inflammation, pain, stiffness, and reduced mobility, which the good news is can be managed throughout rehabilitation. So now that we know what degenerative joint disease is, let's test your knowledge about it. So what do you think about this? Is this true or false? Only the elderly get osteoarthritis. It is false. If you look at this graph, arthritis can begin to develop earlier than you may think. Look how many people between the 18 to 44 age group have been diagnosed with arthritis. Imagine how many people are living with the beginnings of arthritis and don't even realize it. So to begin our discussion today, I think we have to start at understanding what happens to joints as we age. As we age, it's completely normal for our joints to go through some changes. Just like our skin wrinkles and our hair turns gray, our joints also show signs of wear and tear over time. One of the biggest changes happens to the cartilage. That's that smooth, rubbery tissue that cushions our joints and helps them to move smoothly. Over time, the cartilage can wear down. This might be due to the natural aging process, but it also can be influenced by things like previous injuries, repetitive movements, our weight, and as we mentioned before, even our genetics. When this happens, you may notice symptoms like pain, stiffness, or even a grinding sensation in your joints. Osteoarthritis is the most common form of arthritis and affects a staggering number of people. In the United States, there are 58.5 million people living with this condition. That's nearly 1 in 4 people. And while OA can affect anyone, it's more common in females than males. Hormonal differences, joint structure, and even lifestyle factors may contribute to this. Age is another major factor. The older we get, the more likely we are to develop osteoarthritis. Certain jobs and activities also can increase our risk. For example, occupations that require repetitive joint use, like heavy lifting, squatting, or kneeling, can put extra strain on our joints and speed up cartilage breakdown. On the flip side, contrary to popular belief, low physical activity can also contribute to this, like sitting for prolonged periods. This can make our joints stiff and also can contribute to degeneration. So you may be wondering, why do some people get really bad arthritis and others don't? And to be honest, we don't fully understand the process of how DJD develops, but we continue to learn more and more about it every single day. As we discussed, it's likely a cause of both biomechanical and biological factors. Most often it develops gradually, so we don't really know why. You'll notice symptoms occasionally that you might equate to being a strain or simply overdoing it, but then it grows more and more consistent with time. Occasionally, DJD develops as a result of trauma, and this is known as post-traumatic osteoarthritis. A really good example of this is there are a lot of people in their youth, especially, having ACL tears, and this can set you up for arthritis in the future. Though any joint may be affected by degenerative joint disease, we most commonly see it in our knees, hips, shoulders, hands, and spine. When we talk about preventing or managing osteoarthritis, it's helpful to understand the difference between modifiable and non-modifiable risk factors, which this table shows. In other words, what we can change, that's modifiable, versus what we can't change. Those are the non-modifiable things. So let's start with the non-modifiable risk factors. These are the things we can't control, but they play a role in the development of osteoarthritis. Some of these we've already discussed. So age. The older we get, the more likely we are to experience joint degeneration. Our gender. Women are more likely than men to develop osteoarthritis, especially after menopause. Genetics. A family history of OA can increase your risk. So if your mom had knee replacements and your dad had knee replacements, there's a chance that you may develop knee osteoarthritis. Ethnicity also has an effect, potentially. Some studies suggest that Caucasian individuals may have a higher prevalence of OA. And finally, congenital malformations, which is just a fancy term for something that you're born with. These structural issues can be present from birth and can lead to uneven joint wear over time. One of the most common ones that you may be familiar with is hip dysplasia. Now, here's the empowering part, the modifiable risk factors. These are areas that we can take action and make a difference. Obesity is one thing that we can really mitigate our risk of developing degenerative joint disease, because we know that extra weight puts more stress on our weight-bearing joints like our knees and hips, and is directly correlated with the development of osteoarthritis. Our injury history also has an influence. So if you've had a joint injury, make sure to rehabilitate it fully, because if you don't, and there are strength imbalances or other residual side effects, this can lead to joint wear and tear. Our occupation. Like I mentioned before, jobs with repetitive motions, heavy lifting, prolonged kneeling, this can all increase stress on our joints. Joint protection strategies and activity modification tips can be addressed by both physical therapists and occupational therapists to help protect yourself. And then finally, diabetes. This is a condition linked to systemic inflammation, which can affect joint health. So controlling your diabetes can help control the inflammation that contributes to joint damage. While we can't change our age or genetics, we can make choices to reduce our risk or slow the progression of osteoarthritis. Now let's talk about how arthritis feels. These are the signs and symptoms that people commonly experience, and recognizing them early can make a big difference in managing the condition. Morning stiffness lasting no longer than 30 minutes is a key hallmark sign. This is often one of the first things that we see in the development of DJD. You may feel especially stiff when you wake up or after sitting for a prolonged period of time, but after moving around a bit, that eases up. Aching or sore joint pain. This is how arthritis is commonly described. It tends to worsen with activity and improve with rest. People may experience swelling as well. They may have visible swelling or just tenderness along their joints. We may also start to see reduced motion. And most people will recognize this as some difficulty doing an activity that once didn't cause problems. Things like bending down to tie your shoes or reaching behind your back. Some people will feel instability. This often happens a little bit later on into the development of DJD. But you might feel like your joint is giving way, especially your knee. You might feel like it's going to buckle on you. We might also hear grinding, cracking, or popping sensations. This is called crepitus. And in some cases, a popping noise is 100% normal. And in others, it can be an indicator that something is happening inside your joint. And then the final thing really is weakness. The muscles around the joints can weaken over time, especially if that joint isn't being used as much due to pain. And all of this can lead to reduced mobility and function, which often happens later on as the disease progresses. These symptoms can vary from person to person, though. Some people may experience only one or two of the symptoms we discussed. Some people may experience all of them. In general, though, in the early stages of DJD, people report feeling pain with activity and relief with rest. And by early stages, we're talking about the left side of the picture on your screen, stages 1 and 2. This is where we start to see the beginnings of cartilage loss, and maybe some small bone spurs, which we call osteophytes, may appear. In the later stages of DJD, people report more constant pain, and they start to really notice limitations in their movement, like you have difficulty putting on your shoes. For the later stages, we're talking about the right side of the picture on your screen, stages 3 and 4. Stage 4 is commonly referred to as end-stage osteoarthritis or bone on bone. Here we see a reduction in the joint space, greater cartilage damage, and large bone spurs. If you or someone you know is experiencing any of these signs, it's a good idea to talk to a healthcare provider, such as your PT or OT. When possible, early intervention is the best. Now let's start to discuss what can be done to help manage a degenerative joint condition. This is not all doom and gloom. We can help this. I'm going to start with a general overview for you. This graphic shows a pyramid representing the traditional approach to managing osteoarthritis. It's designed to guide treatment based on the severity of symptoms, starting with the most conservative options, and as we go up the pyramid, we progress to more intensive interventions. The levels are non-pharmacological approaches at the bottom. Then you go on to topical pain relievers and systemic analgesics, so those are oral medications that you'll take. Level 3 is intra-articular glucocorticoids, which is a class of injectables, so injections into the joint. And then finally, the top of the pyramid, we have total joint replacement surgery, which is reserved for cases where conservative management has failed. Woven throughout all of this is physical therapy and rehabilitation. We are able to help every step along the way. Level 1 interventions focus on lifestyle strategies like education, exercise, and weight loss, and possibly using an assisted device or brace, like a cane or a knee brace. These are considered first-line treatments and are often very effective. As a fun fact, there are only 3 things that most major medical associations agree on for the early management of osteoarthritis. They are weight management, patient-centered care and education, and therapeutic exercise. And here's another fun fact. Rehabilitative clinicians, such as PTs, we can help address all of these things for you. The next level of intervention involves topical NSAIDs, so non-steroidal anti-inflammatories like an ibuprofen, and capsaicin creams, which can help reduce localized pain without the systemic side effects of an oral medication. Oral medications like NSAIDs and acetaminophen are used when pain becomes more persistent or widespread. When this doesn't work, prescription medications like a meloxicam or Celebrex may be prescribed. So physicians will typically start with an over-the-counter medication and progress to a written prescription if needed. There are many benefits to these medications. Research indicates prescription-strength NSAIDs can significantly improve pain relief and function in people living with osteoarthritis. But we need to balance the risks with the rewards, right? So if you take these medications over a prolonged period of time, you may have a higher incidence of gastrointestinal adverse events, particularly things like abdominal pain, when compared to people who are not taking these medications. Level 3 interventions are the injections that are given directly into your joint, and they can provide short-term relief. They're great, especially if you're in a flare-up. So sometimes the arthritis or DJD pain stays at bay, and other times it can really kind of ramp up. That's what we call flare-ups. There are several different types of injections, all of which have different purposes and different levels of efficacy. The 3 most commonly deployed injections are cortisone. Cortisone is used to stop the inflammatory response that happens with arthritis, and the inflammation is a big contributor to pain. The clinical evidence demonstrates that cortisone injections can provide moderate short-term pain relief, but the effects often diminish within 3 months, though this varies with patient to patient. The purpose of a gel injection, which is something you may be hearing about a lot, is to supplement the properties of the fluid inside our joints. We have this thing called synovial fluid that lubricates our joints and makes them glide nicely. But this fluid reduces with arthritis. So these injections aim to improve the joint lubrication, reduce pain, and enhance our function. Recent research and medical guidelines suggest that while gel injections may provide modest pain relief, the clinical significance is limited, and it seems to benefit mostly people in those early stages of degenerative joint disease, not when you've reached the bone-on-bone end stage. The purpose of platelet-rich plasma, or better known as PRP injections, is to deliver a concentrated source of growth factor and cytokines. These are those fancy natural elements in our blood that help us with healing. You put those directly into the affected joint with the goal of reducing inflammation and alleviating pain. PRP injections may offer short-term symptomatic relief in some patients with OA, but robust evidence for long-term benefit or the ability to improve arthritis is lacking. So current medical guidelines do not recommend their routine use. This is another visual of what we just talked about. And what you can see woven throughout all is physical and occupational rehabilitation. We're able to intervene every step along the way. So for example, if you have an injection and you're at level 3, we can help you get stronger, get more flexible, improve your balance and move better while we have the injection on board to help with pain control. If you're just at the start of a level 1, let us teach you the ways to help manage your osteoarthritis. The key takeaway is that conservative management is the foundation of osteoarthritis care. Medications and surgeries are important tools, but they're typically used when other strategies are not enough. The earlier we can intervene with movement education and support, the better the outcomes. So next, let's talk about what you can do to address the health of your joints. Let's start with another myth busting. So true or false? Rest is best for joint pain. What do you think? The answer here is false. Movement helps lubricate joints and reduce pain. Exercise helps in management of osteoarthritis. With OA, we typically see stiffness, reduced strength, weakness. All of these things contribute to limited function. So by moving and staying active, you maintain your movement and function. As we like to say, motion is lotion. This graphic here depicts some things that you can do and general recommendations for physical activity when managing osteoarthritis. Things like low impact aerobic exercises like Tai Chi, aquatic therapy, biking, walking, all of these things are great. We also recommend things like strengthening and then flexibility and range of motion exercises. These all combat the negative side effects that we see with arthritis. General recommendation here is to do 150 minutes of moderate activity every week and have at least 2 days of strengthening included. But even 45 minutes a week can help improve or maintain function. So every bit goes a long way. Another key thing that you can do to help manage osteoarthritis is weight management. We talked about how this is directly linked to the development of osteoarthritis because we know that extra weight puts extra pressure on the joints. So losing weight can help reduce pain and theoretically to decrease the risk of developing or prevent worsening of osteoarthritis. This has a large impact. Did you know that losing just 1 pound can reduce 4 pounds of pressure at the knee, 5 to 6 pounds of pressure at the hip, and 4 to 6 pounds of pressure at the ankle? So think, that's just 1 pound. Imagine 5 pounds, what a difference that makes. It can make things like climbing stairs like this gentleman is doing become much easier and feasible. We also like to talk to people about joint protection strategies, right? We need to protect the joints and make sure that we're moving in an optimal way. Things like good posture makes a big difference. Proper lifting mechanics to prevent injuries. You can see here some examples of how to lift and move properly to protect your joints. And activity modification. If you're in a job or doing activity that involves a lot of repetitive motion or repetitive loading to your joint, your physical or occupational therapist can help you develop some modifications to move well and move better. So, we say get it checked out. We, as rehabilitation clinicians, can play a large role in the management of osteoarthritis. We use things like best practice guidelines that are developed by major medical associations so that we can assess the most important physical features of osteoarthritis. Then we track your progress over time. So we want to know, how are you doing? Are you meeting your goals? And we want to collaborate with you to make sure that you have the plan that is best suited for you and your individual needs. And we understand as therapists the nuanced process of OA. You cannot rehabilitate knee arthritis in the same fashion that you could rehabilitate, an 18-year-old soccer star who sprains their knee. We push you when you need to be pushed, and we can scale back when we need to as well, so that you get the proper care. So now I'm going to turn it over to Mike, who's going to talk to us about the role of physical therapy along our osteoarthritis journey.
True or false? Exercise will make my arthritis worse. False. Building muscle to support joints helps maintain function. Stretching keeps your motion so that you can do the activities that matter to you. If you don't use it, you lose it. This is a schematic of our OrthoVive patient journey. OrthoVive is Select Medical's comprehensive degenerative joint disease program. Let's take a trip along the journey of a patient who would be in our OrthoVive program. First, we have early intervention or early recognition. This is rehabilitation focused on prevention of disease progression or minimizing the effects of the disease at hand. Your rehabilitation specialist can act as your gatekeeper or middleman between you, the patient, and the physician. We recommend early intervention for those patients at high risk. So patients who have had joint injury in the past, higher BMI, repetitive activities, or genetic risk factors that Erica had spoke about earlier. Conservative care is for people who are already experiencing the symptoms of osteoarthritis. The small symptoms matter, just like the check engine light in your car. We want to get these symptoms, this little bit of pain checked out as soon as it appears. We don't want to stop you from playing tennis or going for that hike with your family. We can address your strength, motion, and stability to ensure that you're moving with the right patterns to eliminate joint stresses. We can't cure the arthritis, but we can help manage it, and we can help you optimize your function to continue to do the things that you enjoy doing. Our next stop is prehabilitation. We know that preoperative health status is a strong predictor of postoperative outcome. The stronger you are going in, the stronger you'll be coming out. The better your motion is going in, the better motion will be coming out. This is a proactive approach to prepare patients physically to get ready for a surgery. Just as you would study for a test or prepare for an athletic event, you can think of prehabilitation as your preparation for the surgery. We're going to increase strength, flexibility, work on your balance and endurance to ensure that we can get you ready for the best possible outcome. Our preoperative visit is a visit that happens a few days to a few weeks prior to your surgery. This is largely an educational visit where we teach you things like trying how to navigate up and down your stairs with your assistive device, how to get into and out of your car, into and out of your bed, or even into and out of the chair. We teach you how to appropriately position to help minimize the symptoms that you may be experiencing after the surgery. Our postoperative rehabilitation is an individualized program to help you meet your goals. We'll address pre-existing weaknesses and stiffnesses that may be worsened by the surgery. We can fix movement patterns that have become compensatory from the disease process that you were experiencing. We work with your surgeon to ensure a safe and full recovery from your replacement surgery. The role of the therapist along the osteoarthritic journey is to reduce pain, improve function, and increase your quality of life. And with that, I'll pass you back to Erica.
Those are great tips, Mike. Thanks so much. It seems like you have people there every step along the way to help. So let's tie this all together with a story. I love a good story. This is about my patient, Jen. I met her when she was 42, and she was the picture of health. She loved to do yoga, she loved to surf, and she was at a yoga retreat in Tonga, of all places, but she had a hard fall off a surfboard, and this changed everything for her. She returned home with a labral tear and discovered that she already had moderate hip osteoarthritis on top of it. She consulted with 4 different orthopedic surgeons, but all of them said that they did not recommend surgery at the time. She had too much arthritis to fix the labrum, but she had not enough arthritis to do a hip replacement. So she was kind of stuck in no man's land. She began working with a physiatrist and tried some of those PRP injections that we talked about earlier with moderate results, but nothing really lasted. So over the next 5 years, Jen and I worked tirelessly to manage her symptoms. As her therapist, I became the gatekeeper of her degenerative joint disease. We tracked her hip motion, adjusted her treatment plans accordingly, and helped her stay active for as long as possible. By age 47, she needed a cane and her mobility had significantly declined. She finally became a candidate for a total hip replacement at that time. And after surgery, we worked with her on restoring her range of motion and mobility. She made a remarkable recovery and returned to the active lifestyle that she craved and loved. She's stronger, more resilient, and pain-free, better than ever before. Throughout PT, we were able to support her, keep her moving, and ultimately return her to the life she loved, whether it was conservative management of her DJD or postoperative care. So we did the entire spectrum that Mike just talked to us about. So no matter where you are in your degenerative joint disease journey, we are here to help. As we wrap up today's talk, I want to leave you with a few important takeaways. First, recognize the signs and symptoms of joint disease early on. Whether it's stiffness, pain, or reduced mobility, as Mike had mentioned, the small symptoms matter. Don't ignore them. Second, don't wait to seek help. Early intervention makes a big difference in keeping you moving and improving your quality of life. And then finally, remember that staying active and strong is one of your best defenses against osteoarthritis and degenerative joint disease. Movement is medicine, and with the right guidance, you can maintain your mobility, independence, and lifestyle for years to come. Thank you for being here today and for taking the time to learn about joint health. If you have any questions or want to explore treatment options, we're here to help. Have a great day.